to the United Breast Cancer Foundation. Your donation will help women, men, and families affected by breast cancer nationwide. Schedule your donation. Call 1-877-654-DONATE or visit driveoutbreastcancer.org. An estimated 2,350 men will be diagnosed with breast cancer this year, and 440 will lose their battle. Be a champion and support the United Breast Cancer Foundation.
Men and women can be diagnosed with breast cancer. Why do you think it's important to increase breast cancer awareness for both women and men?
I believe that because the cancer situation is rampant today, I think that everybody should be investigated for it. I think that it benefits all. And I think that in the end, everybody benefits from having the what do you call it? I can't remember the term for it.
Check if you have it.
Yeah, just
a mammogram.
Yeah, get the mammograms just to make sure that everything is good.
To be able to catch it early and get it treated early on in the findings of it instead of waiting, prolonging, and then it's harder to.
Yes, and mammograms are very important for men and women, and that's the easiest way to catch it early.
And I agree with that too. I have a best friend that she was just diagnosed with stage 4 breast cancer, but they caught it and it had spread into her bones, but they caught it, and actually she's in remission almost now. And I did have a best friend, a male friend, that was diagnosed with breast cancer, and he's in full remission now. So mammograms are very important.
Because it's becoming a younger age diagnosis for men and women both alike.
Definitely just awareness is the process of getting the cure out and getting, a chance for everybody to be checked up, healed, whatever needs to be done.
Because you said it, both men and women can get breast cancer, and it kills both genders.
Well, it's such a problem, and it seems to be getting more and more common, and more men especially need to be more aware of it, and our governments they need to do a lot more funding on cancer in general, but breast cancer especially for women and men.
It's a quality thing for everybody to be aware of breast cancer. With being aware of breast cancer, perhaps you can get early prevention. Early prevention maybe would mean that you could get, healed from it perhaps.
Because it can happen to anyone. You don't know. My father-in-law actually has breast cancer, and I absolutely agree it's very important for everyone because anybody can be affected.
Because anybody needs help. Cancer is a bad thing for anybody to contact, and they all need help.
It's a very serious thing. My wife just had a bout with cancer this year, recovering now, and research needs to be done, more research, and I don't understand why there's not a cure yet.
Imagine for a minute that you or a loved one is diagnosed with breast cancer. How do you think this diagnosis would affect your family?
I've seen that. The reality is it devastates the entire family. Everybody feels the pain of the one that's going through it. And then on top of it, everyone's trying to help the person that's dealing with it on a daily basis, and it's very difficult.
My grandmother was diagnosed with it, and she did pass away from it, so it did affect the family really, really hard.
I think it would be really hard on the family members. I know it's hard on the person that has it, but the family members are going through it too. But I can't imagine. I've never had anybody in my family with breast cancer, so I really don't know, but I just can't imagine going through it.
It would be hard on both the family and yourself. As I said, with my best friend having breast cancer, I went through it with her and her new husband, and it was rough. But I've been there for her, so.
It affects them very intensely. My mother actually died from breast cancer at the age of 50, and I was actually diagnosed at the age of 31.
Oh, wow.
I think there'd be an emotional stress on all people involved. I mean, that's why I guess breast cancer awareness would be something that it's not just the person that's diagnosed with it, it'd be the people that are affected, throughout the family and everything as well. So, I mean, getting the awareness out would probably be a great thing for them.
We would surround the person and support them and try to get them through it as best as we could.
Well, we would rally around and support that person as much as we could. We would try and get the best medical care that we could for them. And other than that support, I guess we would do a lot of research about it to see what's going on with them and if we're agreeing with the doctor or whether to get a second opinion on various treatments.
Everybody
would be
everybody is
affected by that.
affected with that. I personally have been affected by it, so I don't know. It brings everybody to closer in arms.
Tighter.
So yeah, it's.
I think it has a really strong impact on the family dynamic. Again, my father was diagnosed, and it had a severe impact on us. We didn't know, how long he would survive, or, how much time we had left with him. And luckily, he is in remission. But it definitely creates a sense of you treasure what you have as long as you have it.
I would say it would affect it dramatically. I did have a daughter with a brain tumor at one time, so I do understand the cancer problem, and it's devastating for the whole family.
Well, it opens your eyes. It's been around for years, but until you deal with it directly, it changes the way you do things, the way you think, and it's a crazy situation.
99% of breast cancers are curable when detected early. Do you do monthly self-breast exams?
Yes, it's very important to do that. And then if you do find something, to go ahead and follow up with your doctor, because it's very important to find it early.
Yes, I do, every month.
Yes, I do, every month.
Personally, I don't. Actually, I have a male friend of mine that I talked to just a few weeks ago, actually, that was diagnosed, and it was by accident that they found the lump. So it's definitely something that men should be more aware about.
Fortunately, I don't have to anymore because I was diagnosed. I had breast cancer on both sides, so I actually had a bilateral mastectomy. So I subsequently now just have to follow up with the oncologist every 5 or 6 years.
Okay.
I don't. Personally, until today, I didn't know that it was both or equally, imperative for men and women to have breast exams done. So.
Yes.
No, I don't. I do get ultrasounds and mammograms done twice a year.
I do not. I'd say maybe quarterly, every few months.
No, I do not.
No, I'm old and stubborn.
Well, I think if the situation between the two is strong, I think that once the female is diagnosed with breast cancer, it should basically strengthen the relationship, because it's at that point that the importance of true love and the importance of caring is there. So I think it's vital that the person actually takes concern and cares for the one that's been affected.
Yes, it is a very big concern. You just have to be able to support them and make sure you go through the proper physical therapies and psychological therapies to help out with the both of them.
Yeah, I mean, the husband or the wife, either one, whichever one has the breast cancer, you have to be there and be strong and support that person with the breast cancer, not just say, oh, well, I can't do this anymore. It's just not fair. If you love somebody, you'll do it for them.
That's right. My best friend, when she had her breast cancer, she was actually engaged to the guy, and he actually stood by her through the whole time. And then they actually got married after her breast cancer, after her surgery. So
Huge. Absolutely. I was very fortunate that my partner did not abandon me during that time, but I know many, many friends that they have been just abandoned, and not even just by their partner, but by their family, because all of a sudden they look differently, and because then we don't feel the same, we accidentally take it out on our partners and our family and our loved ones.
I wouldn't think so. Because I think the love, for the person, and then the whole institution of what they've gone through, I think personally it's above the breast, if you will.
Not if you have a strong relationship and a good partner.
Abandonment from their apartments? Wow, I guess that would sort of depend on their spouse or their partner that they were with and how they were handling it as well. I'm sure it does happen, and I'm sure it's very hard on both partners. And I'm sure the woman has a very hard time with it. But I would hope that they would support each other and get through this.
No, I wouldn't think it should be. Not from their...
No, I don't think that would affect it.
Maybe if they were single, it could become problematic. But
I can understand how that can be an effect from a mastectomy. you lose a lot of self-confidence, I think, as a woman, having lost something that represents, women. And I think it's something that could definitely be addressed and helped for women that have undergone that type of procedure.
I think some people might feel that. I don't. You love them, you love them.
Would you like to share any words of encouragement to men or women who may be battling breast cancer?
I want them to know that the entire population is behind them 100%. We know that it's a terrible disease, and we understand the amount of pain and the amount of sorrow that follows the disease, and that everyone near and everyone around definitely is behind them 110%, and we're praying for them every day.
To stay strong and do all the examinations that you need to get done, and if you do have someone that is, to always stand beside them and give them the proper support they need.
Yeah, the same as Brandy said, just help them and be there for them, and make sure you go through the right channels. And
I'd say the same thing too, but just be there for everybody. They need your support as well.
Just keep striving forward. That's the best advice that someone gave me, is just keep going. Strive for the future. There's always new improvements. I mean, my goodness, my mom was diagnosed back when I was 15 years old, and I'm 46 now. Just the advancement alone, you just have to keep moving forward. You have to work for the cause.
I think people, like you say, should be checked often, checked monthly. You've just got to go through the chores of doing, the things that are going to help you, be detected early. Make sure that, you're not, one of the numbers that don't get checked, and then I think it'd just be the most beneficial thing to all if people, honestly, other than a regular exam from a doctor, self-examination, like you say, is a monthly deal. It just needs to be done.
Just hang in there. Everything's curable, and know that we're out there to support you.
I guess just do the monthly checks, get checked out by your physician, make sure you feel comfortable with the amount of checking that you're getting, and if not, then maybe change doctors or find another doctor that's giving you enough health care that you think that you're getting.
Yeah, you can do this. You can get this.
Just keep, living the dream and enjoying every moment that you have. There are so many people out there who support and love the men and women who have undergone and faced breast cancer. Just know that those people are there to support you through everything.
Oh, please, just hope is all you can go for. Just keep on working, and maybe someday they'll find something that cures it all.
Well, go to the doctor, get checked often. It's not a joke, it's not a game. Very, very serious, and early diagnosis, very important.
Together we can make a difference.
UBCF! UBCF! UBCF!
UBCF! UBCF! UBCF!
UBCF.
UBCF.
UBCF!
UBCF.